Can you really put a price on your health, Sean? The older I get, the more I realize it's all about my health, my body, my vitality, and that of my families as well. If you have a concern that there might be a condition, that you are undergoing, get peace of mind. Go to Preventative Diagnostic Centers right here in the Valley and get their scan. It's really something else.
It really is. Dr. John Pierce is here. He's the medical director of Preventative Diagnostic Centers, which really, I mean, the technology you have there is incredible. Doctor, it's great having you.
Thank you for having me. How are you two of you doing?
We're doing very well, and we know that you are helping people do very well here in the Valley. Let's talk about the technology that you have that is really exclusive to Las Vegas.
Well, yeah. So we have this Siemens Somatom Go All Pro CT scanner. What's exclusive about it is that it actually measures the individual who's going into it to determine their density, and that then calculates that into the dose of radiation that they're going to get. So we can give them the lowest effective dose to get the most precise imaging, so we can make the most or the best recommendation for them based off of our findings.
Yeah, and I'm glad you mentioned the radiation right away, because that is certainly a concern with many folks when it comes to any kind of x-ray or scan. Let's talk about some of the conditions that this scan can find.
Oh, some of the ones we've already found was pretty amazing. We found a lot of heart disease. And what I find is, I always ask the patients, are you a smoker or diabetic? And if the answer is yes to one or both of those, and 99% of the time it is yes for the people that have the most calcified coronary arteries. So those are two conditions that we want people to keep under control with diabetes, or quit smoking. And then you really greatly reduce your risk of coronary artery disease. So we see that, and I've sent a handful of patients to the cardiologist. I've gotten some notes back from the cardiologist saying, this person was sitting on a time bomb. Wow. They had an 80-90% blockage. They came to us asymptomatically, but we were able to stent them, get them good medical treatment before they were, allowed to suffer potentially a catastrophic event. We found a lung cancer in a lady long before it gave her any symptoms. And the type of lung cancer that we found was small cell carcinoma, which is a very, very aggressive lung cancer. Most people, by the time they have symptoms, it's too late.
Wow.
So they found this in her, and she was able to go on and get further treatment. And as the best of my knowledge, she's cancer-free, still going through treatment, but with a very good prognosis, much better than it would have been, say, 6 months later.
Wow.
Had it been found.
Yeah.
This is like a life cheat code, honestly, just to be able to get a second shot and be able to catch stuff super early like this is just fantastic. Obviously cancer and heart disease, they're big killers in the United States. Frederick was somebody that walked into your location not too long ago. Tell us about Frederick.
Well, Frederick came in and he had some concerns, and we did the scan and, kind of allow him to tell a little bit about it. But it seems that the things that we found were potentially life-saving for Frederick, right?
All right, let's take a look.
I was out on a small hike, and it occurred, felt like heartburn. I ignored it on the suggestion from my fiance. She insisted that I seek medical attention. And I'd say, do it before it's too late. I would have never met my last born grandchild had I not listened to it. And don't wait till you're 59. Do it early.
Wow, it's incredible. And without this technology, you may not have been able to catch that in time.
That's correct. And so he's one step ahead of the game. And, with proper following in the medical field, with the proper specialists, he can have a much better outcome as his life continues on.
Unreal.
And I'll mention my experience, Doctor. I came in and had a scan, of course, and I didn't know entirely what to expect, but I really appreciated that every step of the process was explained to me. And I asked a lot of questions, believe me, like an annoying amount of questions. The thing I appreciated is that the scan, there's absolutely no pain. There's no fear involved. There's no claustrophobia involved. It's actually remarkably simple. And I think that's a testament to, where technology is at these days. I know that the machine that you have, I think the only other one like it on the West Coast may be up in the Bay Area. Isn't that right?
That is correct. And I think one of the things you alluded to previously was the speed at which the scan was done. It was almost amazing to you. Like, am I done? And we're like, yeah, I'll set it.
Very simple.
You kicked me out.
It's all right. You can leave now, JJ. Before
She
we
was
go,
asking questions going into it. So
you've got this scan. What do you do with the scan? All right, we got this thing. How do we look at it? How do we know what we're looking at?
well, fortunately, you don't have to look at it and you don't have to interpret it. We have a board certified radiologist that does all that. So once he goes through the scan, he kind of does his what we call read, and then we get those results. If there's any abnormalities or concerns, then we'll call the patient, and I personally speak with the patients to kind of give them direction as their next best step. A lot of times that's following up with their primary care doctor, a cardiologist. Sometimes the radiologist will say, and like in the case that we had, the young lady that we found the lung cancer in, wasn't quite sure what it was. He said, let's do a scan in 3 to 4 months. We did that, and we'd seen some progression. We recommended that she went off to get further studies done, and they did some biopsies and found this cancer, right? So the radiologist with his years of experience is able to determine. Sometimes we find little, I'll call ditzels in the lungs per se, and they're granulomas. He has no concern, no follow-up needed. But a lot of times if he feels that there's a follow-up needed, he'll say to do so. When we get that, it gives us more information. Is this thing growing? And that's one of the big signs.
Well, doctor, thank you so much. We want to mention your special offer. And by the way, I have to say, this is one of the benefits of this. I think maybe that you're offering the scan at such a low price.
Well, yeah. So we want people to come in. We're offering a heart scan for a couple for $125. Now, normally that's $599 per individual. So it's one heck of a savings. We want to get people in the door so we can at least look at their coronary artery health.
It's close to 90% off. I mean, that's really an awesome opportunity. I just did the quick math in my head. I failed math many years, but I'm pretty sure that I had that right. Doctor, it's great having you. Thank you so much for joining us.
Thank you, John.
Thank you.
All right, take advantage of that special offer. Heart scan for the couple, just $125. Usually it's $599 per person. Give them a call, 534-7900. Visit their website or visit their location in Southwest Valley. Preventative Diagnostic Center, a proud sponsor of The Morning Blend.